Did you know the way we offer health benefits in the United States started more than 80 years ago during World War II? Today, there's a new player in the game, health reimbursement arrangements, or HRAs. In this video, I'll explore the history of HRAs. The origins of employer-sponsored healthcare. First, let's talk about the start of employer-sponsored healthcare. In the early 20th century, factory jobs were tough, and so were the health risks. To attract and retain workers, some companies offered on-site medical care. Then, by the 1940s, employer-sponsored group health insurance became the norm. Then, in 1954, the IRS allowed businesses to deduct their health benefit costs, and employees didn't have to pay taxes on those benefits. This made group health insurance one of the most desirable workplace perks. In the 1960s, healthcare started to get more expensive. To help, employers created informal arrangements to reimburse workers for out-of-pocket costs like co-pays and deductibles. These early plans were the blueprint for modern-day HRAs. Defined contributions and HRAs grow. Fast forward to the late 1990s, and some employers started ditching one-size-fits-all group plans. Instead, they gave employees a set allowance to spend on the medical expenses they chose. These defined contribution plans were flexible and cost-effective, much like a 401k became for retirement benefits. In 2002, the IRS made it official. They formally defined health reimbursement arrangements in Notice 2002-45 and Revenue Ruling 2002-41. Key rules included the following. Only employers could fund HRAs. Tax-free reimbursements were allowed for items in Section 213B. It allowed for monthly and annual rollover of allowances. And employers could reimburse employees for insurance premiums. Early adopters like Zane Benefits, which later became PeopleKeep, began helping employers administer HRAs during this time. Temporary setback, healthcare reforms. However, in 2013, the IRS rules changed due to the Affordable Care Act. HRAs were reclassified as group plans, which meant that they had to follow ACA rules like covering essential health benefits with no annual dollar limits. The IRS ruled that HRAs couldn't follow this rule because employer contributions were limited, even though employees could buy health plans without annual limits with their allowance. This change prohibited HRAs from integrating with individual health insurance plans. However, employers could still offer an integrated HRA, also called a group coverage HRA or GICHRA. This type of HRA pairs with a group health plan to cover out-of-pocket costs. HRAs make a comeback for small businesses. Then came a turning point. In 2016, the 21st Century Cures Act introduced the Qualified Small Employer HRA, or QSERA. This version of the HRA is for small businesses with fewer than 50 full-time equivalent employees. It once again allowed small businesses to reimburse employees tax-free for their individual health insurance premiums and out-of-pocket medical expenses. Zane Benefits launched PeopleKeep Health to offer the first cloud-based QSERA administration platform. The federal government expands HRA options. In October 2017, President Donald Trump issued an executive order asking the Departments of the Treasury, Labor, and Health and Human Services to expand the availability and usability of HRAs. The departments responded by creating 2 new types of HRAs in 2019, which first became available to employers in 2020. These included a new standalone HRA, the Individual Coverage HRA, or ICHRA, and a new integrated HRA called the Accepted Benefit HRA, or IBRA. The ICHRA now allows employers of all sizes to reimburse employees for their individual health insurance premiums and out-of-pocket medical expenses. This has been a game changer for health benefits, as large employers who offer an affordable allowance can use the ICHRA to satisfy the ACA's employer mandate. PeopleKeep was the first to market an ICHRA administration solution, bringing one to the market in summer 2019 for a January 1st, 2020 start date. Why HRAs work today? Today, HRAs are more popular than ever, driven by the growth of HCRA and ICHRA. Thousands of employers are realizing savings by canceling their traditional group health plans and switching to a standalone HRA. With a standalone HRA, employers set their budget and employees pick the coverage that best fits their needs. At PeopleKeep by Remodel Health, we make HRA administration easy for small and mid-sized employers. We handle documentation and claims reviews, establish plan documents, and provide a simple administration software solution. If you're a large employer seeking more compliance help and white-glove customer service, Remodel Health's ICHRA Plus solution is for you. You can learn more about HRAs at peoplekeep.com. We've also provided a link to our full article on the history of HRAs in the description, so be sure to check that out. If you found this video helpful, be sure to give it a like and subscribe for more health benefits tips. Thanks for watching.